just knowing the information which will, help you, in the long run as far as doing your daily activities and stuff like that. So my portion will be on diabetes and chronic kidney disease. All right. Alright, so today's message is just because you don't feel sick doesn't mean something isn't happening in your body. Okay. So, both can sometimes be a silent issues as far as diabetes and chronic kidney disease. So, how many of us has gone to a checkup and you feel fine, but then you get your labs back and you're like, hold on, what's going on here? Yeah. All right. So that's why this is important. Go into your doctors and asking questions and trying to educate yourself on what's going on in your body. So. What is diabetes? Our bodies use glucose or sugar for energy. Insulin helps move that sugar from the blood into the body cells. When your blood sugar stays too high, it can damage different parts of your body. So diabetes can affect your heart, your blood vessels, your eyes, your kidneys, your nerves, your feet, and so much more. So, what are some things you think? What are some things you think about when you think about diabetes? Anybody?
High blood pressure.
High blood pressure. It could be related, definitely. Anything else?
Lose your limbs.
Lose your limbs.
Insulin, taking medication.
Yep. Yes. So, I know a lot of people used to say like diabetes, the sugars and stuff like that. It's so much more than the sugars.
So much more than
Yeah. So one reason diabetes can be dangerous is because high blood sugar does not always make you feel sick. You walk around and you think you're feeling normal, and then you start feeling these symptoms of like increased thirst, frequent urination, you're tired, blurry vision, and unexplained weight loss. So
maybe that.
some people have few, some people have noticeable, symptoms. So if you don't feel sick, how would you know your blood sugar is high? Anybody?
I take my pressure every day.
Okay.
Okay.
So when you feel these symptoms, are you going to the doctors and getting your lab work done?
Yeah.
That's what you should be doing, because that's going to, tell the full story about what's going on in your body. So, blood sugar. So talking about blood sugar, so before your meal, your blood sugar should be about 80 to 130. And then 1 to 2 hours after, it should be less than 180. So low blood sugar is below 70. So these are the general numbers. Some of them, dependent on, what medications you take, age, and just different health issues that could affect that. So when you go see your doctor, they'll have a personalized plan for you, what's best for you. But when you go to the doctors, it's important to say, what are my goals? Where should I be at, and check in every 3 to 6 months. So your blood sugar tells you what's happening right now. Your A1C gives a bigger picture for the past approximately 2 to 3 months. So some older adults may have a different A1C goal, which is fine. So, like I said, just checking in with your doctor and just saying like, okay, so where should I be at, and what's going to be the healthiest point for me. So some signs for when your sugar is low is shaking, sweating, weakness, dizziness, headache, confusion, and feeling hungry or trouble walking or talking. In older adults, low blood sugar can sometimes look different. So the key thing is if someone has diabetes suddenly, and they seem confused, you might need to get your blood pressure checked. Just don't assume you just, oh, I'm high or I'm low. You don't want to take insulin or take anything to try to combat it. And, so checking your blood sugar should be the first thing. So now we're going to talk about how that affects your kidneys. So does anyone know what our kidneys do for our body? Yep. So our kidneys act like a filter. They remove waste and extra fluid from the body.
Yeah.
They also keep important things in balance. So diabetes is one of the major health conditions that can damage kidneys over time, as well as high blood pressure. So chronic kidney disease can also be silent, especially in the early stages. A person can gradually lose kidney function and still feel okay. As kidney disease becomes more advanced, some people may experience swelling in feet and legs, fatigue, changes in urination, nausea, loss of appetite, sleep problems, and muscle cramps. Not all of these symptoms guarantee that your kidneys are healthy, but you don't want to wait. So that's why it's important to get everything checked. So, yes.
Yeah, my son-in-law used to only drink ginger ale soda.
Mm-hmm.
He never drank water,
Okay.
ever.
Mm-hmm.
And what happened to him, his feet started swelling. He thought, he had diabetes too.
Mm-hmm.
But then he wasn't paying that no mind. He had a bad kidney infection, almost killed him.
Wow.
And they told him that night, 2 nights, they gave him this medication.
Mhm.
He said the 3rd day, if it did not take, he was going to be on dialysis.
Okay.
But thank God for prayer and different things going on.
Right.
And so now he drinks water,
Mhm.
but they had to do surgery.
Okay.
They do something to his kidney, and then now he has prostate cancer. So, but he's going through.
Yeah.
But he almost totally died from his kidney infection.
Wow. Yeah. So it's important,
Yeah,
filtering out that
now he
sugar.
on ginger ale.
Yeah, filtering out that sugar in your body is really important.
Ginger ale all the time. No water.
So yeah, definitely keeping away from sugary things, salty things. It's so. I know it's hard. It's hard.
Very hard. I hate it. I hate it.
So another thing is, getting your blood work checked. So with kidney failure, not kidney failure. With checking on your kidneys, you can get blood work done and you can get a urinalysis done. So we'll pass out a paper later, and it'll have the different ways that you can get things checked. And when you go to your doctors, you can say like, okay, the normal number is this, so where am I at? So we'll hand out a paper just so if you ever want to, when you go to your doctors, you can know your numbers. Yeah. So.
The one thing with kidney disease, you don't know you got it.
Mm-hmm.
You don't know you have it until they
Get your labs done.
get your it just be incidental that you find out.
Mm-hmm. Definitely. So like that's why it's a silent health issue. Definitely.
Silent killer. Yes, me.
You really can't?
I'm trying to get myself together.
So let's put everything together. Over time, high blood sugar can damage small vessels that help kidney filter properly. High blood pressure can also damage those blood vessels as well. So 4 important things to know. So to know your blood sugar, ask about your target personal blood sugar target. Know your A1C. So know your average blood sugar over time. Know your kidney numbers. So we'll hand out the paper so it can be more clear, but ask what your EGRF is and
What's that?
So that's the blood test that you get. And then, ask for about, what my urine test is, and, just be involved and advocate for yourself. That's really important, especially, when you go to these appointments, if you're alone and you're confused and stuff like that, you don't know what they're really talking about, definitely, advocate for yourself. Ask more questions and be, don't be afraid to, ask questions about your health because it's important.
I have a nurse friend of mine. She goes with me to the doctor because some of the stuff I don't understand. I got chronic kidney disease, and she tells me everything. So I'm getting some tests done this whole soon.
Okay.
But other than that, I'm getting fine to do it.
Yeah.
Try to drink a lot of water.
Yeah, just keep working on those things and for the meantime, and even afterwards, this is just going to be a change in your life that you just want to, keep trying to do better so that we can have a longevity of life, Yes.
Why when you go to the doctor, your blood pressure be good, but when you go to the doctor, raise it sky high, you be crying, stressed out.
Anxiety.
Anxiety,
Nervousness.
nervousness about your appointment. You've been thinking like, oh, what am I?
Yes.
So once you get there, it's skyrocket
Yes.
because you've been worried all week, all day. Like, oh no, I got a doctor's appointment coming up.
I do now. I also don't know. When I first go in there, it is anxiety.
Yeah.
You go to the bathroom, you go all that stuff. Then they walk you back to the room.
Yeah.
You sit down and try and get your breath, and they're gonna come take your blood pressure. I said,
Give me a
take my
minute.
blood pressure.
Yeah.
I have to take my
Sometimes they
I
take
do.
it
I try to get nervous, upset, everything.
Yep, that's a good one. That's a good one to get it checked the second time.
Yeah, they do that.
I had a phone call. This was about maybe 6 or 7 years ago.
They do it though. They do it.
I was,
Yep.
I would call myself, trying to get rid of some of the weight. So I was drinking lemon water all the time,
Okay.
right? And I was eating lemon water, and I love bananas. So I got this phone call from, I don't know if it was a PA or from a doctor, and they said, Miss Ross, have you been eating a lot of lemons or anything, And I said, yeah, I use lemons all the time. I use lemons with, water all the time. So he said, is there anything else that you eat that you like to eat? I said, not bananas. Do you know this man said, try not to eat no more, don't eat any more lemons, and don't eat any more bananas? And he never told me why. Didn't tell me why. It took 3 years later for me to go through emergency that I found out, I was sick, and they gave me a blood test, and it came back and said that I had chronic kidney disease. But it wasn't until last year that I found out that the potassium was doing something to my kidneys, blocking my kidneys or what have you. And it wasn't until then that I found out, and I'm talking years later, that I found out what the lemons was doing and what the bananas was doing. So I haven't had any lemons since, and I haven't had any, well, I did cheat and have a banana like once or twice last year. I love bananas, but I don't eat no bananas, and I don't use no lemons. That I did have lemon Saturday.
Okay.
But that's the first time I've had lemon, and when I tell you in years, but they call and they tell you this stuff, but they don't tell you why. You know, and I mean, that's dangerous because I never even knew why. So it just so happens that when I went to the doctors, I picked up a piece of paper. You know how they information laying around. I picked up a piece of paper, and this paper had, you know, the foods that had potassium in it, and that's how I found out.
I have a question. Isn't potassium good for you though?
Not too
I mean, I'm not potassium, bananas, because it's good in potassium.
Not too
But in
much.
moderation.
In moderation, well, it was over the top before I found out. Even in moderation, I didn't know anything. They didn't
Right.
tell me nothing.
Yeah, so that's why. That next question, why, you know, advocating for yourself. Because, yes, he should have told you and explained everything. But definitely, that next question is
They
why.
didn't tell me nothing. I'm like, what the hell? What's that about?
So, our nurse, Crystal, she'll go into more, she can explain more definitely about potassium and lemon. But definitely moderation, you know, I don't think moderation. So, I do understand that with chronic illnesses, that we do have some barriers to health conditions, you know, as far as transportation, cost, difficulty understanding instructions, forgetting medications, limited mobility, living alone, too many appointments, feeling overwhelmed, lack of support, and difficulty affording food. So, one thing I want you to remember is managing your health. Managing your health is not always about what to do. Sometimes sometimes people know what they need to do, but life gets in the way. So,
One more thing I like to add, and getting your a doctor's appointment. Because now, if you go to the doctor, you might wait 3 months.
Yeah.
You know, and don't have to counsel. If you counsel, that's 3 more.
Exactly.
Yeah, you're right.
definitely, especially with the specialist.
Yeah, especially if it's a
Specialist.
The specialist, yeah.
Life be life.
Being on top of it, keeping those appointments, even though it's anxiety written, I know, but you gotta keep those appointments, making sure you're showing up. And then I just wanna encourage you to, you know, ask questions for understanding. Bring a family member or support if you can. Use medication reminders. Keep track of important health numbers. Ask for help with transportation and other barriers if you can. I know everybody in their own world. Stay connected with your family and friends and your community. Attend regular health appointments and